Good morning, students. Today we have autonomic function tests. As practical, before going to the practical part, I'd like to tell about the autonomic functions. What is meant by autonomic nervous system, and also what are the functions or how it will be maintaining the autonomic functions in the divided into central and the peripheral nervous system. As you know, in the peripheral nervous system we have somatic or the voluntary, it supplies the skeletal muscles. Autonomic or involuntary, supplies cardiac and smooth muscle. This autonomic nervous system is again divided into sympathetic and the parasympathetic. Here you can see in the central nervous system mainly brain and spinal cord are there. Brain contains cerebral hemisphere and the brain stem and cerebellum. All together we call it as brain. And spinal cord is having different branches: cervical, thoracic, lumbar, sacral and coccygeal. The cervical we have 8 segments are there. In thoracic 12 segments, lumbar 5 segments, sacral 5 segments and coccygeal are 1 segment is there. So here also you can see clearly peripheral nervous system, cranial nerves and the spinal nerves. Somatic motor neurons and the autonomic motor neurons. Somatic motor neurons, they supplies the skeletal muscle. Here they are all somatic motor neurons, autonomic motor neurons contain spinal cord. Somatic motor neuron are the myelinated. It releases acetylcholine. Effector organs are the skeletal muscles. Excitatory neurotransmitter is acetylcholine. Autonomic motor neurons, preganglionic, postganglionic are there. In this we have sympathetic, parasympathetic. All together we have adrenergic, cholinergic. Both are there. Preganglionic are always most brain and spinal cord. First the preganglionic neurons, they terminates into autonomic ganglion. From the autonomic ganglion, postganglion neurons, they supply smooth muscle glands. These are the target tissue in the autonomic nervous system. Autonomic ganglion. The definition of autonomic ganglion: collection of neurons outside central nervous system. And the functions are, they will be going to the distribution centers, the innervating, depending upon the different effector organs. There will be brain stem and spinal cord. Types of ganglion we have: paravertebral, collateral, terminal, adrenal gland. Different ganglions are there. This is the section of spinal cord, cell body of the preganglionic neurons. From here we have sympathetic neurons. Preganglionic sympathetic neurons terminate in the sympathetic ganglion. From there, postganglionic neurons, they will be supplying the effector organs, that is smooth muscle, cardiac muscle, and the heart. Sympathetic, parasympathetic. Sympathetic mainly mediates through stress. During stressful situations, fight or flight reactions, during exercise, emergency situations. Parasympathetic are mainly for the digestion and also maintain normal homeostasis of the gastrointestinal functions and also genitourinary functions, and also for the digestion, defecation and diuresis. These are the different functions of parasympathetic. Here we can see how it is innervating. Parasympathetic, sympathetic. Cranial branches here. We have third nerve, seventh nerve, ninth and 10th. Cranial. Supplying the eye and also lacrimal salivary glands. And also it supplies to the lung and bronchi and also heart through vagus, parasympathetic. Some stomach and also here the liver. Here we have some branches to the pancreas, large intestine, small intestine, rectum, bladder, genitalia. These are the sacral branches. Thoracolumbar, we have thoracic and the lumbar, L2 to L2. These are the sympathetic branches. Like parasympathetic, sympathetic is also supplying to the kidney, liver, GIT and also bladder, genitalia. Both are having different functions. In the head and neck we have eye and salivary glands. In the thorax, upper thorax, lower thorax. Coronaries, heart, increase the heart rate and increase the contraction, sympathetic, through sympathetic. Coronary vasodilatation. Lungs also. Pulmonary and bronchodilation. Splanchnic nerves. Suprarenal gland secretes 80% of adrenal to 20% noradrenaline. Splanchnic nerves, retention of urine, retention of feces. Parasympathetic origin. Third nerve, seventh nerve, ninth nerve, 10th cranial nerves. Third nerve supplies the eyes for the eyeball movement and salivary secretion, 7th and 9th, and thorax and thoracic and abdomen. Pelvic, sacral plexus supplies to the bladder. Not only that one, supply for the ejaculation and also for contraction along with the sympathetic and parasympathetic. Sympathetic, dilatation of pupil, inhibition of saliva, acceleration of the heartbeat. Sympathetic, dilatation of bronchi, inhibition of peristalsis and secretion, conversion of glycogen to glucose in the liver. In the adrenal gland, secretion of adrenaline and noradrenaline, and the bladder inhibits the bladder contractions. These are the different functions of sympathetic. Parasympathetic, here you see the eyes constriction opposite to the sympathetic and stimulation of the saliva. Here there is inhibition, here it is stimulation. Slows the heart rate, whereas sympathetic accelerates the heart rate. Constricts bronchial constriction, whereas sympathetic bronchial dilatation. Stimulates peristalsis and secretion in the GIT. Inhibits peristalsis secretion by the sympathetic. Stimulates release of bile and also contraction of the bladder. whereas sympathetic inhibits the contraction of the bladder. Thoracolumbar is the sympathetic, and we have past 7th, 3rd, 9th, 10th nerves, and sacral S2, 3, 4. Ganglion always away from the organ, ganglia near the organ. Postganglionic neurons are longer, and whereas in the parasympathetic they are short. Neurotransmitters are noradrenaline, acetylcholine, whereas parasympathetic always acetylcholine. Functions: sympathetic, heart rate increases and force of contraction increases, and the blood vessels constriction. And also lungs bronchodilation. GI decrease the motility, sphincter contraction, decrease the secretion. Whereas parasympathetic decrease the heart rate and also force of contraction, dilatation of the blood vessels, bronchoconstriction, GIT increase the motility, sphincter relaxation increase. Acetylcholine, the fibers cholinergic receptors, acetylcholine, noradrenaline. We have cholinergic fibers, adrenergic fibers, adrenaline. Accordingly, the receptors are also neurotransmitters are acetylcholine and also adrenal. Cholinergic receptors, two types, muscarinic and nicotinic. Stress response, sympathetic discharge as one unit, preparation for flight or fight, dilatation of pupil more in light. Thank you.